In fact, we imagined a life expectancy of about 1 month for the patient. Fortunately, we were able to control them after 35 days. And it has been almost a year since they were completely cured.
The movement of experts from the Faculty of Electrical Engineering of the University of Tehran. At the edge of cancer treatment knowledge by building a device that it has become the most effective and least expensive cancer treatment method.
We have been working on this field for almost 5 years, on the treatment of cancer, by electroporation method. In these few years, we were able to make about 3 generations of this device. Cell tests, animal tests. It has been tested on pets for about 2 years, on human clinical trials in 4 different hospitals. This is being done in Tehran.
Talking about the new method of ECT treatment or chemotherapy. It is accompanied by electrical stimulation in the operating room.
Being patients who have all lines or treatment lines such as radiotherapy, having received surgery, multiple chemotherapy treatments and so on. The answer was not reached and we were able to control their disease with this method. He was a candidate for amputation, considering that the lesion was so big in terms of surgery. This did not allow us to operate only on the mass. We had to do amputation. But fortunately, as you can see, after electroporation and the passage of time that gradually the lesion with a session of electroporation. In this way, it starts to become necrotic or dry up. That tumor stopped working and as you can see after 17 weeks, the patient's lesion is completely cured.
We came to the hospital to see the use of this device in the operating room.
Electric voltage in a short time with high power, without having an adverse effect on the vital organs of the body. It opens the cell membrane in the tumor area. And special drugs that are used with very low concentration, which normally cannot enter the cancer cell. With the help of this phenomenon, they enter the cancer cell, their penetration increases 1,000 times. And this makes it in a very short period of less than 2 weeks. That cancer cell will die.
ECT treatment method is the least invasive surgical method, because there is no injury or bleeding in it.
We carefully examined the anesthesia considerations of this method. And we saw that there was no electrical complication in the heart waves or in the contraction of the heart. Or this did not happen in other organizations and this method was able to be effective in this way.
The effectiveness of this treatment method has been proven during 2 years of use on 200 patients.
Because it was unknown to us, we were not very willing to do so. Present their scientific evidence. And we actually experienced it during the surgery. Holes are created inside the tumor where the substance of our chemotherapy penetrates. With a very low dose that has very low toxicity. It causes the destruction of tumoral tissue.
Chemotherapy with electric shock is the only way to treat acute patients who have no chance of treatment.
Patients are referred to us who have undergone several surgeries elsewhere. There are some parts of the tumor that cannot be operated. There are some places of the tumor that are associated with a high risk of death. For example, if we operate on the tumor, the main artery of the body may go with it, and that the patient's life is in danger. With the help of this method, for example, masses in inaccessible places. For example, there is a lump in this area that completely removes the eye. With this different technique that there is an electric portion. In several sessions before the surgery we want to do, these lumps become small. B. Shrinkage. It can be downsized. It means that the tissue becomes small, and the surgery becomes really easier. Or it is inside the nose. Sometimes there is no need for surgery at all. The mass itself falls completely.
This treatment method is now in 4 hospitals of Imam Khomeini, Shohad-e Tadrish, Amir Alam and Rasul Akram have served patients. And soon it will be included in the clinical guide of surgeons all over the country.